I'm Lacey Dolan, and I'm the Health and Wellness Marketing and Communications Coordinator for the University of North Dakota. Today I'm here with Rosie Dube from Student Health Services here on campus. We've been getting a lot of communication from the North Dakota University System, UND, and Centers for Disease Control. We just wanted to talk a little bit more about Ebola today and answer maybe some questions in this video for you guys. So, Rosie, first off, what is Ebola?
Well, as Lacey said, we're here. We have a great respect for the publicity that's come out about Ebola, and we recognize it as a very serious illness with currently being transmitted in 4 countries in Western Africa, those countries being Nigeria, Liberia, Sierra Leone, and Guinea. Those countries are reporting Ebola with a mortality rate of about 50%. As people coming to the university and coming to our town and coming to our campus, they have concerns about what their risks are about Ebola. The Ebola is contagious, but not easily contagious. If we compare it to influenza or measles, those are certainly more highly contagious. Those are spread just through coughing, sneezing, being in the environment with the person. Ebola, in contrast to that, is not quite as infectious. To have Ebola become contagious, you would have to be sick with the disease, and I would have to have direct contact with some of your body fluids. So that would have to come in contact with an open wound on my skin or in my mucous membranes, through my mouth, through my eyes, something like that.
So what you're kind of explaining is that it's not easily contagious, and we're hearing a lot of information about it right now. So if it's not as serious over here, why all the information right now?
I think the U.S. is considered very low risk, and the people exiting those countries are being evaluated. Centers for Disease Control have people in those countries, and they're also being screened as they enter the U.S. So we're low on the tier as far as where people are being cautious. Because it is such a serious illness, we're just being prudent in making sure that we keep our campus, our students safe and healthy and able to continue their academic pursuits. We recognize that students could be frightened by the disease. We also want students, faculty, staff, and the community to understand that we are here because we care about the students and about their success. We want them to have a good experience here at UND, and we want them to be successful. And I think people are really frightened and afraid that, Ebola is like all over campus, and that's not true at all. People that have been in those countries are considered at risk of becoming sick for 21 days after potential exposure. So once they leave that country or leave the person that had been sick with Ebola, they have about 21 days that they could contract, they could harbor that virus and actually become sick. After 21 days, they're considered not going to become infection. There aren't any punitive actions to be taken if somebody does get sick. Nobody's going to be sent back to their country or anything like that. We just want people to understand that if they've been at risk of exposure, we do want to know about that, and we do want to screen them. We on campus and here at Student Health are really excited for the semester to start. We're anxious for the students to get back and to begin their studies. It's just a really vibrant time of year for us. Definitely be respectful of the situation, but not to be overcome with anxiety about it, and not to be afraid. If you could, not to be afraid or alarmed, to be sure and ask questions if you have them, to realize that we do care about your success here at Student Health and at UND as a whole, and we want the best for your personal health as well as your academic success, and that's why we're here.
Absolutely. I think the key that we can take away from today, though, is that if you have been in one of those countries in the past 21 days, please contact Student Health Services at UND at 777-4500 or after hours 780-5000. Your care is important to us, and we thank you for your time, and good luck this semester.